Hello, boys and girls. I am here with our special guest for the 4th Annual African American History Day Camp, Dr. Brian Winston. So please, tell the children, what kind of doctor are you, Dr. Winston?
I'm an internal medicine, preventive medicine doctor.
What is that? What is that?
Internal medicine is basically a field of medicine where you take care of patients who've been admitted to the hospital. I don't cut on patients the way a surgeon would. I don't work on children the way a pediatrician would.
Okay.
I take care of patients that are either outpatient coming in to see the doctor because they've got a pneumonia or because their stomach hurts, or take care of patients who've been admitted to the hospital either after they've had surgery or working them up if they need to have surgery.
That sounds interesting. So is that like a very stressful, high-paced position? Or, I mean, how would you describe your typical shift? Yeah.
It depends on where you work. You can work at a high output, well, you have a lot of patients coming in facility, or you can work at a slower facility. We are recording now at USC, and they're definitely higher volume. You can go to a smaller town, you can work at a community hospital, and some of those even close at 11 p.m. So those aren't as stressful, they aren't as busy.
Okay, and he was saying, children, that we are now at USC Medical School.
Medical Center.
Medical Center. So we kind of caught up with him. He's a busy man, so just to let you know how committed he is.
I don't work here, actually.
He doesn't work here, but he's here visiting a family member.
Yes, my mother's a patient here.
And he squeezed. Okay, I have a question for you from one of our camp participants. Her name is Carolyn Quintaneres.
Okay.
And her first question is, how many people do you help in a day?
Carolyn, that depends on what I'm doing. If I'm seeing patients in an outpatient setting, doctor's office, patients are coming in, I usually have 30-minute intervals. So I'll get there at 8, see my first patient at 8, see a second patient at 8:39 until we go to lunchtime. From 12 to 1. I can sometimes eat, sometimes get caught up on work, and then I see patients from 1 until 4, 1 until 5.
So you can sometimes eat. Eating is not mandatory.
It's not mandatory. I eat when I can.
Okay.
I should eat better than I do.
Okay.
But I eat when I can.
Okay, so protein bars are in your drawer.
I try to. I don't like protein bars too much. I don't like protein bars all that much.
So it's just back to back. So I guess your day goes by pretty fast then. You're just seeing people. You look around. It's probably 5 o'clock.
Yes and no, Carolyn. It depends on how busy of a place you're working. The place where I'm seeing patients is pretty back to back, but as I was saying earlier, if you're at a smaller clinic, you can actually see patients, you may even see them for 45 minutes. So it just depends on where you are. Even in a large city, they have slower paced clinics where you can see patients once every 45 minutes and still not have patients show up every hour the way they're supposed to.
So how long do you work in a day? How many hours?
Oh, I'm sorry. That goes back to what I was saying earlier. If I'm doing outpatient, where I'm the doctor in the doctor's office and folks are just walking in to see me, what we call ambulatory patients, I see those every 30 minutes. But if I'm in the hospital and I'm treating patients that are admitted to the hospital, staying overnight, it gets a little hectic. Get there at 5:30 in the morning, can sometimes stay till 7:30 in the evening. Yeah, and it just depends on what needs to be done.
13 hours.
Yeah, but I mean, you get time in between. You get slow breaks between 2 and 4 in the afternoon. So you get there before the sun comes up, but you do have a few lulls in there where it's not super busy.
Well, Carolyn, I hope that gives you an idea. Now, she has another question. She said, based on all this information you're sharing with us, this sounds exciting, busy, hectic. Why did you want to be a doctor?
I don't know. I can tell you that I wanted to help people, and when I was in college, I remember one of my professors telling me that a garbage man, a gardener, or anybody can help people. What drove me more towards medicine as opposed to being a gardener or doing whatever else was the fact that I enjoyed science. So the fact that I had an inkling or an aptitude for science and the fact that I was interested in helping people made science and made physician
logical.
Made it a logical decision.
How old were you when you just knew? Like, okay, this is what I'm going to do. Was it college or high school?
It was before that. It was probably middle school. I wanted to become a pediatrician. And when I got to med school and I did a month of pediatrics, I got really sick because the kids were all pretty sick and I didn't like working with kids because they're just petri dishes, if you will. And I've been working with adults and I don't get as sick as often. So
okay,
yeah.
So you just didn't have the tough immune system to weather the storm.
I didn't.
Pediatrics.
I didn't.
Okay. So let's see, she has another question here. How are you successful after a patient dies, and do you get grieving time? Have you ever? No. I mean, have you ever seen a patient die? And what did you do? I mean, did you get to go home that day? Did they say just go home and deal with it? I mean, what's it like?
I remember having a patient or two maybe die when I was in med school. There was 30-some-year-old guy who got shot 12 or 13 times in the chest, and he came into the hospital and he died. I was working in the ER as a med student, and there was a woman whose potassium was through the ceiling, and she died. But no one sent me home. I don't think it was a toughen up kind of just deal with it, but you still had work to do. You still had 7 or 8 patients who were living, and you were obligated to help them just like you were obligated to help the person before they died. So, no, I hadn't gone home when a patient dies. I usually take a couple of days to think about it, make sure there wasn't anything that I could have done better. I'll talk it over with my wife, and she'll help me get over the rough spots where there was room for improvement on my part, or there was something I should have thought about that I didn't think about. But up to this point, I haven't had any patients who died directly due to my negligence or me not doing something that I was supposed to do.
I guess it's just part of the job, huh? And so you have to, I guess, to some extent, distance yourself professionally so that you can carry on. Now, that brings me to the military background, because are you not a practicing physician in the military?
I'm in the Army.
Okay.
I'm stationed at Tripler Army Medical Center in Honolulu, Hawaii. And I've got a couple more years obligation. They paid for medical school, and I owe them time after that.
So how many years? Since the Army paid for your medical school, this would be good for a lot of my students, where we're from, San Bernardino County, and the economy is not that great. So a lot of people are getting laid off, and the kids still have these dreams. So, I mean, I guess a kid doesn't necessarily have to come from a family that has money or college money saved, right? They could go into the military, and the military pays for your medical school. Is that how it works?
Well, the thing that I tell people in general is I don't know any broke doctors, or at least the doctors that I do know that are broke, they didn't handle their finances.
Okay.
So they lived above their means, credit card debt consumed them, stuff like that. So you can go to medical school and not go to the military and do fine.
Okay.
You may be sitting on, a couple $100,000 of loans.
Student loans, right.
But they give you 30 years to pay it off. And the payments are a couple $100 a month. So I wouldn't tell you to go to the military just so that you can go to
medical school.
I wouldn't recommend that.
Okay.
I chose to do it, and they probably consumed maybe about $200,000 of my loans, and it was a trade-off because I've had to move several times. My wife doesn't like the idea of moving. I've got to go to Korea without my wife for a year. So just weigh all of your options.
Right. Okay, that's good, honest advice, because we tend to hear from people, hey, the military's the way. You see these commercials, and we're like, hey, because I'm someone who has a master's degree and I have student loans, and I'm thinking, hey, military's sounding kind of appealing right now. So that's good information. What do you like most and least about being a doctor? So what's your favorite part of it, and what's your least favorite part of it?
I think in this society, doctors command a lot of deference or respect. So usually folks are inclined to listen to me if I'm at work. If I'm not at work, then it's whatever. If I'm at work and I'm looking the part, people want to hear.
Got your coat on, you're stinging around your neck.
Looking professional. They want to hear what you have to say, and they're appreciative. So that's one of the things that I do like. Physicians still make a pretty good salary, but you do have to work very hard.
Okay.
So to answer the question about what I like the least,
you like the respect part the most, and the trust that people put in you.
Well, that puts the onus on me to make sure I know what I'm talking about.
That's
and there's
true.
a lot of investment in time and effort to know your craft and to tool your trade. But things that I like least about it, try not to think about those too often. I guess politics, sometimes workplace politics, but that's with doctors, teachers, lawyers, and everyone else.
That is true.
People
So just like the thing about promotions or who gets different opportunities and who's friends with who, it's just like middle school, but only it's in the hospital.
Exactly.
So keep that in mind. Okay. So who other than yourself? I know you mentioned your professor. Who other than yourself? When you said in middle school, I want to be a physician. Who encouraged you? Who said, let's do this? We're going to get that info for you. Who was like your person that pushed you?
To be honest with you, I went to Gardena Valley Christian School, and I don't think that I had any strong mentors there. Didn't have any black male physicians that I knew about until I got to college and went to school in Atlanta. Went to a black college.
You went to Morehouse College.
And there...
Dr. King went there.
Yeah, Martin Luther King Jr. went there. Spike Lee went there.
Samuel Jackson.
Samuel L. Jackson went there. I'm not going to go to the name. But there I felt fostered and I definitely felt supported. And I had a number of classmates who looked like me, came from similar circumstances, and many of us succeeded to go on to become physicians.
How long did it take? I mean, because you did the 4 years at Morehouse, right? You have to do your 5 years undergrad?
Yeah,
okay.
I double majored. I was biology and psychology.
Okay.
I did that. When I graduated, I knew I liked science, and I was thinking about doing a PhD, and I enrolled in grad school. Okay. And I did research, and it didn't really sting me the way it was supposed to sting me.
And medical research.
Yeah, medical research.
Like
HIV research. No, it wasn't. I mean, it was interesting, but it just didn't grab me the way it was supposed to. Okay. And at which point I had to regroup and figure out what it was that I wanted. And I took the MCAT, got into medical school.
Now the MCAT is like the SATs, but the medical college SATs. Okay.
So for every graduate school, there's a preliminary entrance exam. For lawyers, it's the LSAT. For doctors, it's the MCAT. And I'm sure it's the PCAT for pharmacy school. Whatever CAT, college admissions test, CAT being an acronym for. But I took that, got into med school, worked like a dog. Not working as hard now. Not having to see as many patients in the military. I get paid the same whether I see 13 patients a day or 12 as I would if I were a civilian, where it's all tied in how many patients you see. But I'm sorry, what was the question again?
You're telling such a good story. Well, no, how long did it take?
So
you did the 5 years, then you took a year diversion because you wanted to research, right?
Actually, I was enrolled in a PhD program, so I was in there for 2 years.
2 years in the PhD. You don't have to do the PhD. You go straight from college to medical school, right?
Yeah, so let me give you the ideal course. You do 4 years of college, majoring in whatever, but completing year biology, year chemistry, year math, year physical science, year English, year foreign language, and I think there may be a few other electives. So that's 4 years for undergrad. Then you get into med school, that's 4 years. And then you want to complete a residency, and that ranges from, I think the shortest term residency is possibly 2, but I think it's 3, and they can go for general surgery.
Residency is like what? Is that like pre-doctor? Okay, that's like an apprenticeship. That's pre-doctor. That means you're going to be trained during the 2 years.
Yeah, you're a doc at that time, but you're learning your trade. So you're working under a senior doc, and he or she will check to make sure that you're not doing anything hazardous to the health of your patients.
Now, we know that your medical school was paid for through the military. How did you get through undergrad? Because some people, they can't even picture medical school because they're like, how am I going to get through 4 years of college? How am I going to finance that? Did you work? Did you take out student loans in both? I mean, how did you do that? Work during the summers? How did that work?
I did work during the summers. I did not have a whole lot of student loans from undergrad.
Okay.
When I went to college, it wasn't nearly as expensive as it is now. So my parents paid for most of it, and I had a couple scholarships, and that was able to get me through. I bit off a little bit of loans going to grad school because I wasn't working and I was just taking classes and doing research. And for medical school in the state of California, if you guys are fortunate enough to get in there and you're a California resident, I think it's like 9.
UCLA, you mean?
Yeah, UCLA.
UC?
Yeah, the UC system, UCLA, UCSD, San Francisco. I think there are a couple other med schools. There's one private at Stanford and USC. But the UC schools are still cheaper than the private schools, and I think they may be $12,000 a year, somewhere around there. Now
I can handle. I can handle $12,000 a year medical school. Of course, I couldn't handle the curriculum, but I could handle the money. I think. Right. Okay. Let's see what else. I got another question. She had a lot of questions. Carolyn, thank you. I mean, you are leading us in this interview here. What jobs did you have? So we covered that. Were you afraid, ill, or stressed over something? Did you have any kind of experience where at one point you doubted yourself or you stressed out about an exam or your future? Because some people, you know, we hit those points in life.
They say that folks that go to med school are type A personalities. And those are the ones that tend to be nail biters.
Have high anxiety, stress. That's me. I'm a type A.
High anxiety. Definitely for the admission to medical school, that was pretty stressful. But, you know, I mean, it never stops because depending on where you go to med school, if you don't make the cut, I've got a cousin who's in pharmacy school here, and they got a 3.0 requirement. And if you fall below that, you're nail biting until you get back above a 3.0. So it really depends on where you go, and I mean it's just a long hard slog. You're fighting. I don't want to say you're fighting classmates, but there are a lot of people who want to get to medical school. There are fewer who get to medical school, and you don't want to become a dog-eat-dog kind of person.
Right.
But you definitely have to work very hard, and you have to be very diligent, and you just got to bust your buns sometimes and do double time when it comes to studying, when it comes to doing research, when it comes to there's just a lot that's involved because it's so competitive. It's like getting to the NBA. I mean, you can't slouch on much. You got to work hard every day. And I'm not comparing the NBA to becoming a physician. It's a lot easier to become a doctor than to get into the NBA. But it's hard. It's hard.
Hard work, huh?
A lot of hard work.
But you have a lot of responsibility. So we count on you to be smart and over-prepared. So this is good. Okay, I have a question from Abel Cedillo. He is 14 years old. Actually, he has a few questions for you. Let's see if you answer some of these. His first one is, what is a good study skill or habit that you can adopt now that can help you get through medical school? Do you have any tips, your study habits that helped you?
How old is Abel?
He's 14.
That's 6th grade, 7th grade?
That's 8th. Well, that's 9th grade now. 14, 9th grade.
9th grade. I would tell you that good study habits for a 9th grader will prepare you for medical school. Whatever it takes, whatever your learning modality is. Going through high school, I really wasn't on the ball the way I should have been. When I got to college, I learned to study in groups.
We went to high school together, by the way.
Oh, yeah, we went to
I can attest to
high
that.
school. Yeah.
I don't think either of us were on the ball like we were supposed to be.
Definitely. So I got to college and I studied by myself. And when I got to med school, I studied in groups. And it's kind of funny because you would expect, or at least, I kind of shunned studying in groups because I thought there would be too much time lost. But when you just have volumes of information, you can divvy it up. Yeah, if you got volumes of information, a good study partner, you guys can just talk it out. And sometimes you don't even always have time to write everything down. And you just come up with creative ways to remember things.
The conversation, that's part of
exactly.
it. Yeah,
That
you guys are talking about the material.
Yeah, if you got a good study partner, just the way that they can explain it, you can remember. And I remember being in med school answering questions based on what my study partner, Russell, would tell me. We'd go through it together, and, you just kind of, you have to utilize all of your faculties when you're dealing with a whole lot of information. And that's essentially what med school is. It's just, as they say, siphoning off from a fire hose. So you're just dealing with volumes and volumes of material, and you're just trying to lock it down in your brain as best you can. Yeah.
So is it worth it? His question is, at the end of all this, he's saying, is it worth all that studying, the money, the stress, the anxiety, the responsibility? Is it worth it?
To be honest, is this Abel's question?
This is Abel's question.
I'm so far into it. Yeah, I passed the point of no return, Abel. So I can't tell you. I'm in it. I owe loans. I'm stuck. I certainly have many good days. I do have bad days, but I would do that. I'd have bad days if I were a teacher, if I were a dentist, if I were a lawyer, if I were a trash person. So, you kind of have to put it all in perspective. And at the end of the day, you have to do something that you find fulfilling. And unfortunately, you have to make that decision several years before you know what you're going to do.
That's right.
So, just kind of go with your gut feeling. And if you feel like medicine is your calling, like I said, bust your buns, work as hard as you can, and you deal with all that on the backside after you made it through.
Right.
Yeah.
Right. That's very good advice. And now we have a different question dealing with veterinary medicine, which is the care of animals. You have a question from Amelia Wood. She's 11 years old. She's a 6th grader in Moreno Valley. She wants to be a vet, and she wants to know, what can I do to prepare myself? She said, I've read books on dogs. I've studied different breeds. And she's very eager to kind of just get her feet wet. So what should she be doing now at 6th grade level? I mean, what do you encourage her to do?
They won't let a 6th grader put hands on an animal to correct or fix him. So you're going to have to keep doing what you're doing.
The studying part, the reading.
Just reading. Yeah, I know that a friend of mine went to vet school, and they had, I don't know if it's called a VCAT, a veterinary college admissions test, but you go through 4 years of college. Usually your junior or senior year, you take a test that will determine whether or not you're accepted into vet school after you graduate. And then I believe vet school is 4 years like med school. So just reading and learn as much as you can about animals, so that when you get into it, whether you decide to do biology as a major or what have you, zoology, as Shannon was saying earlier. You'll just be more familiar, more aware of what's going on.
Yes, Amelia, we did talk about your question earlier because I was curious too, and I asked him, should she major in zoology? And he was telling me that nowadays you don't really have to, that they want you to be well-rounded, right?
You know what? No, I can't speak for
veterinary medicine?
vet school,
Okay.
but for med school, I was a biology and psychology major, so I was in the traditional hard sciences, requiring me to study a whole lot. But I know many folks who've been English majors, who've been Spanish majors, who've been, a number of different majors. And from what I understand now, med schools are looking for variety. So they're not just looking for, your traditional biology major, chemistry major. They're looking for folks who've traveled the world and done different things in humanities, for example.
Well-rounded folks,
yeah.
huh? Okay, and I do know for the apprenticeship, because one of her questions was, how old do you have to be an apprentice? I believe it's 18.
Okay.
And then I also think that if you didn't want to be a veterinarian, you could be a veterinary technician with an associate's degree and on-the-job training. So there's some alternatives for people who may still want to work in the field, but perhaps they don't want to do the whole veterinary academy type thing. So I think that's a great question. I don't hear too many kids saying they want to practice veterinary medicine. So I think that's great because I have 2 pets. Do you have pets?
I do. I've got one.
See, we need you.
Yeah.
So very good question. And so boys and girls, this is Dr. Winston. Thank you so much for taking time for our camp. And we're going to be sure to thank him in a big way. Thank you.